Even 1% of what I read. Okay. YouTube is going on. Yeah, sorry. I'll formally start the session. So this is, I welcome all of you for this one more session on immunology and reproductive immunology. So this session, I think, is highly specialized because many things and concepts first time I'm hearing. And all I knew was only to give a probiotic like Ecoflora when it started like 12 years back. And that time we used to just assume that it would help and give it. So today we will learn about uterine microbiome by Dr. Mehta, who I think I had mentioned that this is going to be very innovative, and also this is something which has a lot of potential in terms of treating recurrent implantation failures and recurrent miscarriages. So I request everyone to go through the past 5 sessions because it will make more sense to all of you if you do it in continuity. And there is a lot to learn from the previous 5 sessions regarding RIF and RM. Yeah, over to you, sir. You can start.
Okay, so I will start with the screen sharing. Okay, remember, most of the things which we are going to discuss, okay, in today's session. Can you see the screen, Shilpa madam?
It has just started screen sharing. Just wait for 10 minutes or you can restart it.
Okay. All right, let me just see now. Just see. It's visible?
Yes.
Yeah.
Okay. So, actually, we are going to discuss the role of endometrial microbiomes. Okay. Now, let me first tell you majority of the concept which we know as far as the endometrium and everything is concerned, or as far as the microbiology is concerned, is all going to change in the next 2 to 3 years. Okay. This is what the endometrium looks like. Okay. Behind the endometrium, obviously, we have the rectum, which is coming along. Okay. And what are we trying to tell is that whenever there comes a blastocyst embryo, okay, which wants to come inside and gets implanted in the endometrium. And if I magnify this endometrium, so we have done this magnification many times for all of you now. Okay, you have, if you go through the previous sessions, you would realize that here you have the blastocyst embryo here. All right. And then you are going to have the villus cells. So we have explained this, the syncytiotrophoblast, and then the syncytiotrophoblast would actually invade inside. Okay, and inside this, there is going to be presence of the arterioles which are coming from the uterus. So if I just draw the vessels here, I think this is a good diagrammatic representation of everything. Okay, and in this you have 3-4 guys who are important for us. One is NK cells, then comes T cells, and then comes B cells. The B cells are in very limited concentration, but we know one thing, that the NK cells which are present at the time of implantation, they form 70% of the cells which are present. All right. And it is this 70% of the cells which are going to create an altered immune response. Okay. This altered immune response which they create, they allow for a successful implantation of the semi allogenic fetus. Correct? So this is what we have all learnt. Right? Now comes the question that, okay, if it is allowing the implantation of a semi-allogenic fetus, very good. Is there anything in the endometrium apart from this, which apart from the embryo? So all this while, if you listen to our lectures, we've only been telling that, okay, when you have a euploid embryo, okay, this embryo needs to be euploid for this crosstalk between the endometrium and the embryo to occur. Okay, now there was a concept which stated that many a times when you are looking at idiopathic cases, okay, of recurrent pregnancy loss, whenever you are looking at idiopathic cases of recurrent implantation failures, you've done everything, you've tried everything, you've sorted everything out. Now you are coming to a particular conclusion that in these type of situations, even if the euploid embryo is not getting implanted, after giving steroids, after doing LIT, after giving IVIG, after giving intralipid, all that Ram Kahani is now finished. Okay, is there anything else also which you should try and consider? So the link came that okay, there could be some endometrial microbacteria which could possibly cause all these things to happen. So if you look at the vagina, the normal vagina is lined with lactobacillus, correct? This lactobacillus is going to line more than 90% of the vagina. It is present there. It is responsible for keeping the pH of the vagina very less. When the pH of the vagina is kept very less, what is going to happen is it alters the immunity in the vagina. So other parasitic bacteria basically, okay, or other parasitic or harmful bacteria, let's just put it that way, okay, or toxic bacteria, they cannot go and adhere to the vagina. But is there any similar concept of having a bacteria inside the endometrium? So a lot of studies were done in order to test all these things. Okay, so people took out biopsies from the endometrium and realized that in the endometrium, if you study in the endometrial cavity, okay, this is very variable based on menstrual cycle. Okay, if the menses is there, everything is going to get washed out. During implantation, it is different. During follicular phase, it is different. It is very, very age related also. As the age keeps on increasing, the bacterial microbiome keeps on changing inside the uterus. It is very severely related to the hormones also, obviously, because it is related to menstrual cycle. You have to understand that it is very severely related to the hormones also. So as a result of this, currently there is no standardization. Okay, there is currently no standardization inside the endometrial microbiome that okay, it is this which is going to cause this particular effect. Nobody can tell you this. All right, but two things or two bacteria have been consistently proven to be present, and I'm going to write down the names of those bacteria. So one is obviously lactobacillus. Okay, so it is lactobacillus iners, that is one, and the second one is Clostridium botulinum. Okay, so the one which gives the botulinum toxin. Okay, these two are the most consistent along all the phases of along all studies, along all phases, everything, all this is consistent. Okay, so then when people began to experiment that okay, you should put vaginal probiotic. Okay, now comes the clinical application. You should put probiotic in the vagina. This probiotic tablet is here. It will disperse a lot of lactobacilli, and this lactobacilli will alter the endometrium and will allow for implantation of the euploid embryo in all cases. Okay, then they realized that the half-life of this vaginal bacteria which is inserted in the vagina is actually very, very bad. Okay, so they went back to something called as, which we all follow actually, and that is oral probiotics. Okay, what does this oral probiotics do? It is very simple. All the bacteria which are then thrown out through the anus, they go and they reverse colonize the vagina. Okay, it is not important that they reverse colonize the vagina from the anus. Okay, so it is basically anovaginal colonization. That is not important. Now the concept for endometrial microbiome has come is that the bacteria which is present here and the bacteria which is present in the gut, okay, is speaking to each other, and that is something called as the gut endometrial axis. Okay, these two people are speaking to each other as to what is going right, what is going wrong. So you ensure that your gut is good. Oral probiotics are given to the patient, and then they did a study on which found out that definitely this is right. It's just that we don't know what is right. Okay, and they came to a beautiful conclusion in this entire thing, that one thing is for sure, at the moment oral probiotics, okay, are better than vaginal probiotics. Okay, that's for sure. Now you will have multiple people who will come to you and tell you that my particular brand of probiotic is going to give you the best oral probiotic. It is going to give RA17. Somebody will tell you no, it has sclery. The other one will tell you no, it has ineri. See, 80% of these bacteria names of the lactobacillus subgroup, no, even the microbiologist does not know. Okay, so when they do not know 80% of the bacteria, it is going to be such a confusing. As IVF practitioners, just remember this line: oral probiotics better than vaginal probiotics. Okay. As IVF consultants, remember one more thing. Any patient whom you are treating for chronic endometritis, absolutely any patient whom you treat for chronic endometritis, for God's sake, okay, any patient, you must always give probiotics orally. Okay, even you can give probiotics at the time of embryo transfer, that is already good only. But in any patient with chronic endometritis, after you finish treating them with the routine course of antibiotics, oral probiotics should be added mandatorily. Okay, that is something which is very, very important for you to remember. Also, please remember that the therapy which you give oral probiotic should be at least 6 to 8 weeks. Okay, you can't give a 10-day therapy and say, okay, go and act. No, it's going to be, at least 12 to 14 days for the colonization to occur in the gut properly. Okay, after that, there will be the cross colonization from the gut to the vagina. So you can't really go and tell the bacteria go and act in 10 days. It will require minimal 6 to 8 days. Sorry, 6 to 8 weeks of colonization, and only then it starts to act. And finally, just remember one more very important thing. This concept will keep on changing based on the more and more studies which will come inside this field. Till this does not come, do not get carried away with any specific type of probiotics which is available, that I give a particular probiotic which will act only and only on the endometrium. At the moment, there is no such thing which is available. I give a probiotic which will act only onto the testis. No such thing. Okay, all this is just theory. You must remember that definitely bacteria play a role as far as altering the immune response is concerned, which is proven, which is why we want to treat chronic endometritis. Had it not been present, we were not treating chronic endometritis, right? So just keep this much in mind at the moment as far as the endometrial microbiome is concerned. Maybe the day we finish like 200 master classes on fertility, some more research would have come on the endometrial microbiome and we can touch it at that point in time. But at the moment, we are restricted to this.
Okay. So are you done? I'm sorry.
Done.
Done. I mean, this is like equal to some 50 papers which I studied. Okay. I'm sorry. See, I think you were talking about vaginal microbiomes and the endometrial microbiome. So obviously the vagina and the cervix also have more than like 10 to power of 5 more microbiomes than the endometrium. So here, are we giving it like too much importance to the endometrial microbiomes? Do you think like, giving, say like Metrogel in cases of like bacterial vaginosis can just take care of this, ask them to eat curds and any probiotic like Yakult, which is just available over the counter? Do you think we can manage with that? Because all these, the Ecoflora, Ecotas, whatever is available, they are quite an expensive therapy. So you think we can be more cost effective by naturally improving and clearing off the infections?
I don't know. I don't think so, because I think there is some problem as far as the gut bacteria is also concerned. Okay, there is a dysbiosis in the gut bacteria which actually causes the vaginal bacteria to go down. Okay, that is also been proven now. That,
Yeah.
like, how you need a strong gut to have a strong fertility, you need this vaginal probiotics. I mean, the vaginal lactobacillus concentration also goes down in cases when you are having a patient who is having ulcerative colitis, for example, right? So that has been now proven without doubt. So I don't think only by eating curd, or even if somebody is bathing in curd, all these things can get fulfilled. I personally don't think so. But they will require some additional supplementary support, because the concentration is, billion colony forming units,
Yeah.
really big concentration. So
Okay. So you were
and see, no, 1 minute.
I'm
And
sorry.
see, these probiotics, madam, are standardized, right? You can't really standardize the curd. So that's the difference, probably. Okay.
Yeah. So see, when we talk about the gut, the dysbiosis and all, see, of late we see more and more of these the ladies who are working in software or in IT industry, basically, who have very haphazard eating habits and probably unhealthy eating habits is what we can say. We expect as the affordability increases, we expect them to have a better health, which is not happening at this moment, especially the clientele that I see, which is more with the IT industry. So do you think rather than checking whether they have this the problem with the microbiome, we should just like a blanket give everybody the ecoflora or ecotas and try
Yeah.
and you think
At
that's
the
the
moment, yes. At the moment, one can give blanket ecoflora. If if more normal bacteria gets colonized in the gut, it will not be a problem for anyone any which ways.
yes,
Correct.
yes.
But you must remember that more bacteria cannot also get colonized, because the ability to gut to colonize the bacteria is also limited. All right. So it is like water soluble vitamins. If it is in excess, it will just get passed out.
Mm-hmm.
And that is also something which you should remember. Only thing is, if you give long term tablets of these probiotics, a lot of people have this abdominal discomfort if the colonization becomes a little severe. Okay, they might have belching and all these things, but otherwise there is no problem.
Okay, so you have stopped using this even you or some other vaginal microbiomes, which are probiotics, which are available now. You don't use the vaginal probiotics?
No, almost in 3 years. No.
Okay. And oral probiotics, there are some which has to be refrigerated, like Combinom, and some which
Yeah.
need not be refrigerated. So what is the
So
difference?
So the ones which the reason is they don't want the lie of the coating of the colony forming units to get disintegrated. See, many a times if you see these tablets of probiotics and if you touch them, no, and if they are disintegrated, then they become very soft. Okay, that soft tablets is not what they are wanting. People, they want the tablet to actually cross the barrier of the stomach and duodenum and then get released in the duodenum. Okay, which is why they are asking to maintain the coating.
Okay, tell me about this isthmosil. I mean, see, when there is that niche which is just there and chronic, there is blood which is irritating. Do you think it has got anything to do with this, the whole spectrum of chronic endometritis and also the
No, it is a part one of evaluation, which is anatomy. So if
Mm.
there is an anatomical defect, you need to correct the anatomical defect. You can't give probiotics. You will have lactobacillus colonizing the isthmosil, but nothing else will happen. So you need to correct the isthmosil and then give probiotics, right?
So have you done the culture of this endometrium just for the sake of to rule out endometritis or to check?
So around 6-8 months back, we had posted a beautiful thing that we are planning to do something called as vaginal microbiome transplant.
Yeah, yeah.
Okay, in our hospital. So we have an excellent microbiologist who is very passionate about doing these cultures. Okay, the thing is, no, it is very tough to culture lactobacilli. That is the first thing. Second, after you culture, it is very tough to lyophilize it also.
Mm.
Third, if you are lucky in all these things, then you have to store it. Okay, so see, we have the deep freeze and all that, minus 25 degrees and all that available for her. But it is very, very tough, because where do you collect the washing from? Correct. If you collect the biopsy from the endometrium, you don't know if it has come from the tip or if it has come from the basal layer or where the endometrium has come from. So it is very, very tough to culture it right now. And what happens is, see, this endometrium has to be lysed first. All the cells and everything has to be lysed. In that lysis, 50 to 80% of the bacteria get killed. That is why if you see most of these endometrial microbiomes which have been reported are basically reported on NGS, basically on platforms which allow for hybridization and DNA matching. They can't be used in routine culture. It's very, very tough.
So you think this, see, usually what happens is the embryo will go and get implanted. It will choose the place where the implantation will happen, like what I have read and what I believe in, rather than the endometrium. So the crosstalk between the embryo and the endometrium, I think the embryo has a dominance over the endometrium where it will go and get stuck. So you think, I mean, it is patchy areas where these microbiomes are lacking, or you think it is just a diffuse thing which can happen? Like how
I think they are patchy areas when you are giving HRT, when you are giving hormone response and trying to prepare the endometrium. I don't think they are patchy areas when it is a modified natural cycle or a complete natural cycle. I don't think so. So
Mhm.
that's the difference, because I think when you have this, see, there is a big importance of corpus luteum because of that only. Those relaxins, activins, whatever 500 proteins it is releasing along with all that. No, they must be going and talking to 235 of these bacteria also, that I'm coming, something like that. And maybe that must be helping in implantation, is what I think. Okay.
See, in those cases, we see the implantation happening, but the live birth rate is not very great, you know. I mean, as far as I have seen, with regard to these kind of little problems that the patients will have, especially once we change from the HRT cycle to a MNC protocol with letrozole. Though the beta HCG will come positive, SAC is seen, but later on, you know, I mean, it really doesn't go forward. I mean, I don't know. That is my experience in this. Okay, tell me, I mean, is obesity one of the factors wherein, like, you know, you think these are the patients that definitely need probiotics for 8 weeks and only then I will start the FET stimulation?
No,
Not really. I mean,
no.
you, okay. So do you think it is the individual immunity of that woman? Which is the factor which drives whether the microbiomes are okay, not okay. Um,
Don't
so it
know.
is still unknown.
I don't know.
Okay. So for now, you think like how we give Ecosprin for everybody. So the probiotic is one such drug which we should all consider before we go ahead and do like a low molecular weight heparin or give them
100%.
stupid,
100%.
not stupid, there's amino acids or say like some fancy medications like embryo say for something like that. Better to like, you know, standardize and put these two, Ecosprin and a probiotic, and maybe like, you know, we can definitely see some kind of a change in the results.
Probably, because see, currently at the moment, as I told you, it is a therapy where there are too many things which people don't know.
Yeah.
Correct. So when people only don't know many things, it will be everything. Everything will be in the air. Is what I
So
think.
how do you think like you see like you continue this once the beta HCG comes positive till how many weeks?
We stop it at 8 weeks, madam.
8 weeks. Okay.
Yeah. There
And
is
by
no
that,
negative effect of the probiotics on this thing.
but why that magic number of 8? Any particular thing?
Yeah, it's just as a protocol, madam. Honestly.
Okay, yeah, sure. Thank you so much. I think you're quite busy. So thank you. It was great. It was a very novel concept, in fact, which I think many of the IVF specialists and also general gynecologists who treat a lot of this RPLs should be aware of, because I definitely think post-COVID, definitely there are definitely some changes in the vaginal microbiome because more and more patients come with recurrent white discharge, recurrent fungal infections, recurrent endometritis, even the best of the ones, you know. I mean, so maybe this will definitely help our patients and also our consultants who are treating such population. So thanks so much